Epidemiologists and public health officials are warning that Kenya is not out of the woods. Gina Kirori has been speaking to a virologist who says risks posed by the gradual reopening of the economy may spur another surge in infections.
Numbers have been of immeasurable value during the COVID-19 pandemic, an indicator on the extent of infection in any given jurisdiction. As the coronavirus cases began to read lower than the usual triple digits, most Kenyans took comfort in the fact that the first wave had passed. Now, if you are among this group of people, then you are sadly mistaken. Virologists say it is too close to call and too early to celebrate.
We are on the lower curve of the first wave, but we have not passed the first wave per se for COVID-19. If we had passed the first wave, we'd be seeing like 5 cases, 10 cases in Kenya, but we're still seeing 600, 400 cases being reported daily by the Ministry of Health.
Kenya has been cautiously easing public health restrictions and reopening key sectors of the economy. But a recent trend in new infections shows a steady rise weeks into the semblance of normalcy. This is as a result of various factors, according to virologists.
Number one is what we are called super spreader events. Now, if you look at recently, you have seen in our politicians have been going to rallies where you find thousands of people gathering. You know, most of them are not wearing masks. Social distance is removed. So that is one kind of characteristics that would actually lead to second wave.
The World Health Organization is also warning that the virus caseload across the world may be higher than reported due to shortcomings in testing and asymptomatic cases considered silent spreaders.
In most countries, less than 10% of the population have been infected with the COVID-19 virus. Letting the virus circulate unchecked, therefore, means allowing unnecessary infections, suffering, and death.
Public health officials agree that the virus may be with us longer.
Majority of the people that it infects actually do recover without even getting, serious disease. So the virus is learning to live with human beings. So the virus is going to be with us for a long time. So how are we going to live with it?
This remains the million-dollar question. Gina Kirori, NTV.